Basically, if you're watching this, this is for you folks that are on Medicare, and this is in the middle or the start of the Medicare annual election period, also known as AEP. So for you folks that are watching this and your plan has terminated, I'm going to discuss what are your options if you're on a Medicare Advantage plan and what actions you should take or what you should do to enroll into a new plan for the following year. And you got to remember that you have two main paths to your Medicare coverage. So a lot of folks are going to talk to you about your Medicare Advantage plan, getting on another Medicare Advantage plan, but we're also getting inbound calls and referrals for those folks that are wanting to look back at original Medicare and a Medicare supplement. So just know that there's two main paths for your Medicare coverage in the marketplace. If you're one of those folks that have, federal health employee coverage along with original Medicare, that's a specific situation. If you're a veteran with original Medicare, that's another specific situation. So obviously there's other health insurance out there other than original Medicare or Medicare Advantage. But for you folks, majority of you folks that are losing their coverage on their Medicare Advantage plans, whether it be United Healthcare, Blue Cross Blue Shield, Aetna, Cigna, and WellCare, there's a number of brands out there that are pulling out their Medicare Advantage plans, especially in the plans that have a PPO or offer a PPO plan. You should have received an annual notice of change letter or a disenrollment letter telling you that your plan will be ending at the end of the year. So if you have not taken a look at your annual notice of change letter that states that there's going to be a disenrollment or a termination of your Medicare Advantage plan, please do that. You can only shop for another Medicare Advantage plan within this time frame of October 15th through December 7th at midnight. If you are shopping for another Medicare Advantage plan or a Medicare Advantage plan that includes Part D drug coverage or a standalone Part D drug plan, all three of those can be shopped during this time period. And I implore you folks to please help your family members and friends out this year because of the nature of the disruption to the Medicare Advantage path for your Medicare coverage. So if you're on United Healthcare and you got a letter, you're a part of the 600,000 plus members from United Healthcare, which their plans are ending at the end of the year. Please don't wait to look into what you need to do to enroll into either a new plan or look back into original Medicare. So I'm going to talk more about the disruption in just a second here. So with that said, I'm Michael C. Fishbach. I run and operate Medicare Savings based out of Charleston, South Carolina. We're a hassle-free, member-based community non-government service for you folks that are on the individual Medicare marketplace. The employers that offer group retiree or Medicare Advantage plans, as well as communities and associations that want to have a service that goes along with them to help educate their members or association. So with that said, let's talk about some case scenarios here. So during this time period, October 15th through December 7th, a lot's going on. There's a lot of calls that you're getting, a lot of bombardment. But during this time period, please don't hesitate to make sure that you are reviewing your coverages. That's whether you have original Medicare, the red, white, and blue Medicare card, and a Part D drug plan, or whether you have Medicare Advantage plan with or without drug coverage during this time period because of so many plans being pulled out of the marketplace for the end of 2025. So if that's you, you got a letter in the mail or email or notification saying that your plan is being terminated or discontinued at the end of 2025, December 31st, then this is the short time frame for you to make sure that you are getting service for you to be able to look at the marketplace as well as comparing the plans out there that are available in your marketplace. So a number of PPOs, I'll just take for an example here in Charleston, have pulled out of the market, and they're not replacing them. A number of companies aren't replacing them with an alternative PPO. So there's more limitations on PPOs for next year, not only locally, but also throughout the US. You can see it in the news and everything like that. But there's going to be around 2 million Medicare beneficiaries that are being disrupted during this time period, which is the largest disruption in Medicare history. So that way, you should be on alert right now to make sure that your Medicare coverage is either going to be around for next year, or you should be reviewing your coverage to make sure that, hey, my Part D drug plan is changing from, say, $20 to $70 or $50 to $148. So please be aware there are a lot of changes for the Medicare beneficiary coverages out there. So let's get back to what I wanted to talk about in terms of some of the plan designs. So for you folks that are used to staying on your plans for an HMO or for a PPO, you may want to look at HMOs for the following year because there's so many PPOs leaving the marketplace. So for an example, here in Charleston, there's a number of PPO Medicare Advantage plans leaving the market. They're also changing the structure and the benefits to where, okay, well, now you have to look at maybe some brands that are not as well known. And so if you want to have a service like that for you or your household, and please, I implore you to help your family members out, especially the ones that are older and don't use technology to their advantage. Please help them to fill out like a easy survey. Here at Medicare Savings, we do a very simple and easy process. So we do a intake survey, and then from there, once we get your medications and your doctors, and that way we can help you look at the plans that include your doctors on the network, or if they're allowed to have in-network or out-of-network. And then from there, we also try to take a look at your medications and try to make sure that it's within the formulary or drug list of that plan. And so those are kind of the two main things that you'll need to give out, as well as what's called a scope of appointment, to make sure that we have permission to help you. Since there's so many scams and fraudulent activity during this time, I implore you to look up a service that's been around for a while. And if you want to look into us here at Charleston, South Carolina, you can clearly and easily see Medicare Savings .us or Medicare Savings in Charleston. So that way you can see that we're legitimate. Just like if you're working with anyone new, you want to make sure that you are working with someone that is legitimate in this space and not giving you the workaround, or not being fraudulent with you. So anyhow, please make sure that you are getting help this Medicare season. Again, October 15th is when it started for you to review your coverages. If you're one of the folks that their plans are being terminated, over, I think, 2 million beneficiaries are being disenrolled from their current plan, please reach out to a service like ours, get in line, and make sure from there you get the information to us, and we can then help create an appointment for you before the deadline. The deadline for the Medicare annual enrollment period is midnight, December 7th, and that's a very short time frame for us to try to help as many folks as possible. Now, I will say, if you are brand new to Medicare, saying you're turning 65 during this time, October, November, December, this time period does not pertain to you because you have a separate designation period known as your initial enrollment period. So if you're just turning 65, just transitioning onto Medicare, the annual election period October 15th to December 7th does not apply to you because you have your own individual designation period, which you can follow with and have 3 months before to where you enroll into your Medicare, and then during your birth month and 3 months after as a kind of leeway. So this designation period of October 15th through December 7th does not apply to you. Okay, so Estella, hey, how are you doing? To sign up for Medicare, this is a good question. So it's kind of not straightforward because it's the federal government. To sign up for Medicare, you're going to go to your Social Security Administration office. You can do an in-person appointment to sign up for your Medicare benefits, your Medicare A, hospital insurance, or your Medicare B, medical insurance. And that's the very first step you want to do when transitioning off, say, an individual health insurance plan or a group employer plan. Once you understand that you're going to transition onto Medicare, and that's kind of where you talk and consult with Medicare specialists, is to see if you can stay on your employer plan. If you're allowed, say the employer is 20 employees or more, you're allowed to stay on their employer plan. If the employer is 20 employees or less, then you would transition onto Medicare. And so depending on the employer size, it can also vary whether Medicare is primary or your group employer plan is primary. But again, if you consult with a Medicare expert, or give us some of the information and do our two-step process, you can make an appointment with us to see when the best time is for you to transition onto Medicare and if it's the best choice for you. Some folks that are currently working past their 65th birth date, they sometimes, if they have what's called creditable coverage, which means it's just as good as Medicare or better, then they elect to stay on to their group health plan from their employer, and then they defer their Medicare Part B. As a lot of times, since Medicare Part A is paid through your FICA taxes, you will accept the Medicare Part A because it's already prepaid via your Medicare and FICA taxes, and that way you can get hospital coverage at no additional cost when you turn 65. But when you're trying to transition and trying to know the steps of how to transition, that can kind of be a big life event for you. So if you're wanting to know how to sign up for Medicare, then please go to ssa.gov/Medicare. If you don't know the processes and steps, I actually have a resource for you guys. It's called www.startmedicare.us, and I have a few videos on there to let you know the exact situation that you're in and process you need to follow. So say if you're brand new to Medicare, you follow the steps for that. If you're transitioning off group health, you follow the steps for that. If you're late to your initial enrollment and went past it, you follow the steps for that. So again, that resource that I created is called startmedicare.us, www.startmedicare.us, like United States. If you can't afford the Medicare fees, that's a great question. So if you can't afford the Medicare fees, like the Medicare Part B premium, because people think Medicare is free, it's actually not free. You pay your FICA taxes all your working years for 40 quarters or 10 years, and then you get the ability to enroll into Medicare and have access to your Medicare Part A. If you have not earned enough credits through Social Security, and say you've worked less than 40 quarters or 10 years, then you may have a premium to pay for Medicare Part A, the hospital insurance. Everyone pays a Medicare Part B premium, regardless of whether they made the 40 quarters or 10 years of FICA taxes. And so for right now, in 2025, the Medicare Part B premium is $185.70. And so that's changing in the following year. But just know, if you have limited income and limited assets, and you fall within the federal poverty limits of what's called the Medicare Savings Programs. That's run by your state Medicaid agencies. And so you should contact your state Medicaid agencies. We actually have I think a line. If you call our number at Medicare Savings, we have it transfer over to your the state Medicare agencies for you to look into. So again, if you're having a hard time affording the Medicare Part B premiums or Medicare Part A premiums, and because due to limited income and limited assets, then you should contact your state Medicaid agency. State Medicaid agency. Every state has its individual branded Medicaid program. Here in South Carolina, it's called Healthy Connections. So that's the Medicaid brand that we have. And so from there, you can apply for the Medicare Savings Program for that state. And again, talk to your Medicaid state agency. Okay. I have medical and LAC 20 credits with single mom. You can also make an appointment with your Social Security Administration to see if there's if you've had a spouse that had enough credits. So if you had a spouse maybe from a previous marriage or something, you can actually look into getting onto their Social Security and be a beneficiary of their I guess their history with the Social Security Administration. So just definitely call up the Social Security Administration, see if you can figure out a way to. Do you have a phone number to get Medi? He didn't have credits. Estelle, yeah, I would say, have you called the Social Security Administration? Looks like I'm glad you're watching this. Okay, so yeah, call the Social Security Administration. Our phone number, if you want to see how we can help you, if possible, is 1-888-608-0654. That's our toll-free hotline. So 1-888-608-0654. And Jade from our member services, or new member services, will happily help you out. Okay, so with that said, let me move on. Okay, so during this time period, again, it's going to be October 15th through December 7th. You folks that are transitioning onto Medicare, that's a totally separate designation period. For the folks that already have their Medicare benefits, whether it's original Medicare, the red, white, and blue Medicare card, and a supplement and Part D drug plan, that's one major path. But most folks that have a Medicare Advantage plan, an HMO or a PPO, and that is where the folks are, they're seeing their disenrollment letters. So for you folks that need assistance, please don't hesitate to call into us. Go to medicaresavings.us. We have a two-step process, real simple, real easy. If we are able to help you, we'll let you know what the plans are that you can shop during this time period. For the folks that may have some some specific questions about their Medicare situation, please call our toll-free hotline 1-888-608-0654, 1-888-608-0654. And if you are a member, we also have a member number for you folks that are watching that are members. It's right on our website as well. So it's an 843 area code. But yeah, let us know what questions you have. Again, it's Medicare and then savings with an S.US, like United States. And that is based out of Charleston, South Carolina. And we've been helping Medicare beneficiaries since 2016, help them into not only transition on Medicare, also look at their coverages. And the way I started was I actually help people with their Medicare supplement plans that could afford original Medicare, and they could lower down their premiums over time. So that's one of the reasons I called it Medicare Savings. All right, guys, I gotta go. It looks like somebody's at the door, and I gotta help some more folks out. But please don't hesitate to reach out to us if you're watching this video. We're going to do more Medicare Savings live videos during AEP. Take care. God bless. Let us know how we can help you. Again, check out medicaresavings.us, or if you're transitioning on to Medicare, check out startmedicare.us if you're signing up for your Medicare benefits.